Maharashtra or what's been happening down south in Karnataka. If the BJP, remember, has frequently attacked the Congress on one particular issue, then it is Rahul Gandhi's Khatakhat model. Apart from Himachal and Telangana, the Congress-ruled Karnataka government has also been receiving a lot of criticism ever since it has come to power. Now, just a few days after, you have the Karnataka Environment Minister proposing a green cess. Now, the government has increased the medical service fees at government hospitals by a 20%. The Bengaluru Medical College and Research Institute, which does run major government hospitals in the city, has revised the price of the medical services. This means that prices at popular government hospitals in Bengaluru, like the Victoria Hospital, the Vani Vilas Hospital, Minto Hospital, and other super specialty hospitals, has been hiked. Now, while the charges for a few services have remained the same, rates for basic services like general treatment, surgeries, blood tests, lab charges, and scans have increased. Now, let's also tell you a comparison between the old and the revised prices that's already up on your screens. While one had to pay 250 rupees for a medical certificate, it's now going to cost you 300. A patient will have to shell out rupees 2,000 for a special single ward as opposed to the earlier price of 750. Diet counseling, diet charges were free of cost. Now they have been priced at rupees 100 and 50 respectively. And speaking on the entire issue, the Karnataka Health Minister Dinesh Gundu Rao has said that this decision was long pending. It is being implemented by this government, calling this just a price revision, which is a slight hike. The minister says that the price increase would add value to the services given to the people.
ಪರಿಷ್ಕರಣೆ ಅಂತ ಹೇಳಿದ್ರೆ ಕೆಲವು ಯೂಸರ್ ಫೀಸ್ ಏನಿರ್ತದೆ ಅದು ಬಹಳ ವರ್ಷಗಳ ಹಿಂದೆ ತೀರ್ಮಾನ ಆಗಿರೋ ಕೆಲವು ಕಡೆ 10% 20% ಈ ತರ ಸ್ವಲ್ಪ ಯಾಕಂದ್ರೆ ಎಲ್ಲ ಆಗಿದ್ದು ಈಗ 10 ರೂಪಾಯಿ ಇರೋದನ್ನ 20 ರೂಪಾಯಿ ಮಾಡೋದು 20 ರೂಪಾಯಿ ಇರೋದನ್ನ 50 ರೂಪಾಯಿ 40 ರೂಪಾಯಿ ಅದರಿಂದ ಅವಾಗಿನ ರೇಟ್ಗಳು ಏನಿತ್ತು ಇವಾಗಿನ ಒಂದು ರೇಟ್ಗೆ ಒಂದು ಹೋಲಿಕೆ ಮಾಡಕ್ಕೆ ಆಗೋದೇ ಇಲ್ಲ ಅದು ಜನರಿಗೂ ಭಾರ ಅಂತ ಏನಲ್ಲ ಜಾಸ್ತಿ ಅದು ಹೊರೆ ಆಗದೇ ಇರೋ ರೀತಿಯಲ್ಲಿ ಇರುವಂತದ್ದು ಅದರಿಂದ ನನಗೆ ಅನ್ಸುತ್ತೆ ಇದೇನು ದೊಡ್ಡ ಏನು ವಿಷಯ ಏನಲ್ಲ ನಾನು ಸರ್ಕಾರ ಏನೇ ಮಾಡಿದ್ರು ಇವತ್ತು ಗ್ಯಾರಂಟಿ ಸ್ಕೀಮ್ ಇಂದ ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಇದು ನನಗೇನು ಅರ್ಥನೇ ಆಗೋದಿಲ್ಲ ನಾವೇನು ಏನೇ ಮಾಡಿದ್ರು ಇವತ್ತು ಗ್ಯಾರಂಟಿ ಸ್ಕೀಮ್ ದುಡ್ಡು ಅದಕ್ಕೆ ಮಾಡ್ತದೆ ಪರಿಷ್ಕರಣೆ ಹಿಂದೆ ಎಲ್ಲ ನೀವು ವಾಟರ್ ಬಿಲ್ಗಳೆಲ್ಲ ಹೆಚ್ಚು ಮಾಡಿಲ್ವಾ ವಾಟರ್ ರೇಟ್ ಹೆಚ್ಚು ಮಾಡಿಲ್ವಾ ಕರೆಂಟ್ ರೇಟ್ ಹೆಚ್ಚು ಮಾಡಿಲ್ವಾ.
Now, the price hike that has provided ammunition to the BJP, the JDS to launch an attack on the state government. Both the parties are blaming the revision of rates on the 5 government guarantee schemes that the Congress had promised during the assembly elections.
All the issues state government, they have actually putting burden on the government, on the common man to actually implement that 5 guarantee programs. For that, unnecessarily they are burdening on the common man. This is not good.
Yet another example of the Khatakhat economics in Karnataka. Lab charges, treatment charges, diagnostic test charges have been increased by 15 to 20%. This means the common man has to suffer even more. And the common man is suffering in Karnataka ever since the Congress party government has come because Congress means loot and jhoot. First you give jhoota guarantees and then you loot the people. Every price and every tax has been imposed on the common man in Karnataka. And this is the Karnataka model of Congress party. They loot the people after giving jhoota guarantees.
And there is also a response that has also come in from the Congress that continues to defend this move, and they say that this price hike will only improve the quality of the medical services. We also have Deepak, who's joining us live, and he's been tracking that story for us. You know, Deepak, the problem is not that this has been just one of the many other hikes. The problem is that there is a real issue with money, whether it's Himachal, whether it is Karnataka, whether it was Telangana, that there's a larger problem of the Congress. You know, you overpromise and then you realize you don't have the budget and then you end up burdening the common man.
Well, you know, in this case, several questions will definitely be asked of the government because, you know, when you consider who are the people who go to government hospitals, it's the poorest of the poor who cannot afford to pay the exorbitant prices at private hospitals. They'll hope that the government that they vote for will do something for them in return, where they can, you know, at affordable prices, go ahead and get the treatment that they need, get the, you know, consultation that they need. But right now, even any increase there, of course, would directly impact the poor. To say that it's a marginal rise, it's not going to make a difference, well, probably not to the affluent, but to, you know, the poor, even 1 rupee is something something that they will, fall back on, and it is something that they'll use to collect, save, and probably get something, worthy for their families. Right now, the opposition, of course, is going all out, attacking the Congress party, questioning whether, this price rise in the hospitals is a direct correlation to the guarantees, because the guarantees are bleeding the exchequer. On the other hand, you're saying that, the price rise needs to be done. The Congress vehemently denies, of course. They're saying no relation to the guarantees. It hasn't been increased for several years, and it was the need of the hour.
Okay, so we let people decide whether that's fair or not fair. For the moment, Deepak, thank you for getting us the latest on that story.